the new Medicare card?
A new Medicare card. This was supposed to be Alicia's presentation, but she has no voice, so I'll do my best. But she learned a whole lot at that PAYCOM conference, so hopefully, I'll be able to do as good a job as she would have. Medicare has made some major changes in the new Medicare card, and let's go over what you need to know. And this is a brief overview. Strongly recommend that you go to the cms.gov website to really learn about it. So why is the card changing? The most important reason it's changing is it's fighting medical identity theft for people in Medicare. The Medicare Access and Chip Reauthorization Act, MACRA, of 2015 requires the removal of the Social Security numbers from all the Medicare cards by April of 2019. And a new Medicare beneficiary identifier, which we'll refer to as MBI, will replace the Social Security number-based health insurance claim number, which we're familiar with, HICN, on the new Medicare cards for Medicare transactions, like for billing, eligibility status, and claim status. So it really comes down to identity theft. And I was wondering when they were going to come around to doing it, since everybody else has been doing it. CMS currently uses the Social Security number-based, health insurance claim number to identify people with Medicare and administer the program. And they have used the HICN with their business partners, the Social Security Administration, the United States Railroad Retirement Board, state Medicaid agencies, healthcare providers, and health plans. And under the new system, for each person enrolled in Medicare, CMS will assign a new Medicare beneficiary identifier. They will be mailing a new Medicare card, and the MBI is confidential like the Social Security number and should be protected as personally identifiable information. So now when you look at your current Medicare card, you'll see the primary beneficiary account holder's Social Security number, plus the beneficiary identification code. So basically it's the Social Security number with like a letter after it. So in the key positions, it's 1 to 9 are numeric, and then you have one letter or a letter and a number and so forth. And then the example here would be the 1, 2, 3, 4, 5, 6, 7, 8, 9A. That would be the primary beneficiary with Medicare. And let's say that you're a spouse who didn't work, you would use your husband's Social Security number, the 1, 2, 3, 4, 5, 6, 7, 8, 9, with the letter B, so to identify. So if you were working and you would have your own number, but there are so many letters. It could be like for dependents and for disabled, or just multiple letters at the end. But the new MBI has new non-intelligent unique identifier 11 bytes. It's like, huh? It's
Wait,
like,
our government having something non-intelligent?
Really?
Sorry, couldn't help myself.
But the key positions, are 2, 5, 8, and 9, will always be alphabetic. So if you look down at this example, we look at the way our Social Security number is now, and it's like the 1, 2, 3, 4, 5, 6, 7, 8, 9, and in this case it's A1, and then the new MBI, and so 1E is the second position, and then this 1EG4, it's very different looking, very, very different looking. And these identifiers are fictitious, and the dashes for display purposes only. They are not stored in the database nor used in file formats. So, but that's the difference. It's going to be so hard to really, I'm so spoiled having the Social Security number. It's going to be hard because a lot of times you don't get good information from the front desk. So you always had the Medicare number. If it ended in an A, you knew that was the social and so forth. But there is a very definite timeline. January 2018 will be activating the MBI generator and translation services. And then from April 1, 2018 through December 31st, 2019, we will transition. And then during this transitional period, you can use either the old number or the new number. And January 2020, only the MBIs on claims will be accepted, with few exceptions.
That's a long transition period.
Yeah, well, I'm grateful because I can just imagine. And this is the timeline, a visual timeline that Alicia presented, where it just shows you, the January 18th, and then the block of time, where they'll accept both the HICN and the MBI, and then the January 2020 where you can no longer use it except for some limited exceptions, and I have listed those. The first bunch of exceptions is Medicare plan exceptions, and that would have to do with appeals, where you can use either the HICN or the MBI for claims appeals and related forms, which makes sense because if you're appealing something during a time period where you use the old number, obviously you can't switch it out. You have to appeal the claim with the old number. Or any adjustments, you can use the HICN indefinitely for some systems such as drug data processing, risk adjustment processing, and encounter data, and for all records, not just adjustments. And then for some reports, I will use the HICN on these reports until further notice. And it's incoming to Medicare, quality reporting, disproportionate share hospital data requests, and so forth. And then outgoing from Medicare, provider statistical and reimbursement reports, accountable care organization reports, and so forth. So it's going to be a slow process before we're really there. And I only cited a couple examples for the fee-for-service. There are a couple more. One is appeals, where, again, you can either use the HICN or the MBI for the claims appeals and the related forms. So if you get a denial, for something December 2019, in January 2020, you obviously have to use the old number in 2020. And the same with the claim status query. If you are looking up something that was done during the time period and you use the old number, you would be able, that's an exception as well. You have to use that old number to query, to see if the claim is pending or paid, and so forth. There are ways that you can learn more. You can participate in the Open Door Forums, which is all advertised through CMS, and they're presented by CMS, and they will be letting you know when the calls are scheduled in MLN Connect's providers. And it's really important. If you haven't subscribed to that, they come through the email and they give you notifications. I strongly recommend you signing up for it. And here it is right here, all the information, the new card and whatnot. There's no gender on this, and so forth.
Guard your card.
Yeah. Seriously, I'm dealing with identity theft, and it's not fun, and it takes forever to clear. So it's really guard the card. You will be able to access the health plan management system for technical information related to the plans, and this is all web-based. And I presented a list here. It's fairly extensive, but it supports the following business processes for all private health and drug plans. And it's everything from contract of plan enumeration and management, formulary submission, marketing material, fiscal soundness, compliance, tracking, financial plan bid, and plan data reporting audits. It's just everything operational.
Yeah.
Data. It's research and evaluation. It's quite extensive. And I think Alicia also have here another link where you could submit any additional comments or questions to the team, because it is going to be a learning curve. And of course, all the information you want to know. And there's a lot. If I could be on here for an hour and a half going through everything, this is just really an overview. Go on to the cms.gov website and read about it and sign up for MLN, because then you'll get the emails and you'll be up to date with everything. So
I like Sally's suggestion to laminate them.
Yeah.
I got one thing to add.
You go ahead.
When at Paycom, they made a point to say no one's going to know when the patients are going to start getting their cards. They're not telling you. And that is also to protect the identity. So that makes everybody kind of panicked, because the patients are going to call you and say, George got his card last week. I haven't gotten mine. Or so-and-so's had his for 3 months. I haven't gotten mine. Is there a problem? And that's addressed on the website. But they said they are not notifying you when the cards are going out to protect the cards because of theft.
Absolutely.
They already recognize it's going to be a problem. So
I forgot you told me that. That's really important too, because I'm sure those patients are going to be calling.
Yeah.
So yeah, like she said, get on that list and let them start giving you the updates and everything, because even if you call, they're not going to tell you that the cards are being mailed out to so-and-so or sections or what areas first. It'll be random.
That's wonderful.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.